Good morning, good afternoon, and good evening. I'm Hannah Morillo, a psychologist from the Philippines, and I come from MLAC Institute for Psychosocial Services. The title of my presentation is Indigenous Psychology in Mental Health Services, a Filipino Psychology Approach. Just for context, the Philippines, like most Asian countries, have challenges in its mental health system, primarily insufficient budget allocation and inadequate human resource and facilities. With the burden of mental illness increasing and affecting lives, the unique geographic, political, and social cultural background of the Philippines share a similar narrative within the region, making it more vulnerable to social determinants that impinge on mental health, especially with our post 2020 time, naming our current situation as a mental health crisis or the next pandemic. In 2018, a new mental health law has been enacted in the Philippines, which includes establishment of mental health services, such as support for community-based mental health care facilities. While mental health policies have yet to be put in place, the World Health Organization and other international humanitarian organizations implement evidence-based mental health psychosocial support, or MHPSS frameworks, to various communities it reaches, particularly targeting low and middle income countries where the treatment gap is palpable. However, the body of evidence supporting MHPSS net frameworks is not exempt from a predominantly global North mainstream lens. The importation of Eurocentric psychological interventions may create a disconnect with the service users, as well as misrepresent a mental condition with a classification system that may not accurately capture certain experiences of mental distress. My perspective on decolonizing psychology is that mental health services need to address a cultural appropriateness by utilizing an indigenous psychology lens. It further asserts that employing indigenous methods not only, one, encourages empirically and culturally driven scholarship to incorporate innovative indigenous ways in intervention, but also to yield favorable mental health outcomes for service users. My perspective comes from an indigenous psychology research I endeavored with the Boracay Ati indigenous group, which you can see on the screen. This paved the way for me to professionally adopt key Filipino psychology concepts and methodologies as an approach to clinical practice. This study enabled a non-othering, respectful stance to understand their worldviews on cultural identity and collective well-being against the backdrop of their current struggle for their ancestral land. Psikolohiang Pilipino, or Filipino psychology, is a kind of indigenous psychology that seeks to get to know Filipinos through this lens. This was formed in the 1970s to address colonialism and exploitation of psychological practice in the Philippines. Filipino psychology is a step towards contributing to a universal psychology. Through this research, I was able to connect with what their issue was as a people that was impinging on their current struggle. The negative emotions, anger, fear was brought forth, and their future hopes and aspirations and attainment of ginhawa, or collective well-being. What may not be fully presented in the nosologies or classifications of mental disorders are the process of how and why they experience such distress. Who are they with? What life event aggravates their condition? Flash forward to my current practice. I wanted to practice like how I conducted Psikolohiyang Pilipino or Filipino psychology research. This research through the indigenous psychology lens was rooted on respect and solidarity with the group. The research question that I eventually had was not imposed and reflected their current struggle and was thoroughly communicated to the group. It was palpable that I was not the expert. I was journeying with them, and in being with them, I am able to help them in the process. This lens enabled me to understand the psychological, not only the symptom-oriented approach in examining the inner world of survivors by letting them speak for themselves, letting them speak what they feel inside, their worldview. The phenomenology of the carer is also laid bare. We share stories and be one with them. From my clinical practice, I believe that it is more important to focus less on technique and more on being with the client. What they say and cannot say, the social determinants impinging on their mental health, or parts of their social milieu that can help them improve their mental well-being. I remember one of the first times I was on the field with a team of psychologists at MLAC Institute and kept thinking no modality from my mostly westernized colonial training of clinical psychology could capture what the displaced child survivor of the strongest typhoon at that time. By relating myself, a Filipino, to another Filipino grieving, in pain, it was more natural for me to offer support. I had to remember that relating the self or kapwa to the other is a core value of Filipino psychology, and this was part of the authentic clinician I wanted to offer. Looking back, I was limited by the very Eurocentric field of psychology, diagnosis, intervention, and the biomedical models. Mainstream clinical psychology still adheres to nosologies and standards. In the face of psychosocial emergencies, authenticity was paramount. And in scaled up community psychosocial support, solidarity was key. This study raises an issue on why the implementation of mental health services need to address its cultural appropriateness, using an emic approach in integrating methods of indigenous psychology to implementation practices, especially those administered at scale. In summary, utilizing a decolonized stance by way of integrating Filipino psychology approaches, not only one encourages empirically and culturally derived scholarship to explore and incorporate innovative indigenous ways in mental health service provision, but also two, yield favorable mental health outcomes for the service users. This is consistent with implementation science strategies that seek to facilitate the uptake of evidence-based research to applicable real-world interventions and policies. To conclude, implementation of mental health services may benefit from addressing its cultural appropriateness and empowering a culture-fair representation of mental health rehabilitation. Thank you for listening, and I wish you a good day.